Okay, so I'm sorry about last Tuesday. I wasn't ready I haven't been streaming in a while, but I guess my performance was lacking. So I decided to restream the same content again today. So just talking about, we're getting ready to do a webinar where we're going to talk about women's health. Okay. And in the 20 years of my experience in treating patients, like I said before, this is a subject that's very near and dear to me because it's just the most rewarding experience in the sense that, you know, you can give people happiness once they achieve their goals. And when everybody's like the hardest thing to do when they're under so much stress to conceive and have a baby, when you can help them along that process, is genuinely one of the best experiences other than live birth. So, which we'll get into that and we can help out with that stuff too. But we're going to talk about women's health. Now, I talked about it and some of the guys out there, right, they shut off, they didn't want to hear it. So let me just make a recommendation for you, right? If you can listen and hear a little bit about that, you're going to realize that if you want your life to go a little bit easier, you do have other women in your life as far as wives and daughters and aunts and nieces and mothers and grandmothers. It's okay to learn a little bit about this and be able to be knowledgeable and more considerate to women's needs beyond women's health, okay? Because I don't have to tell you the most obvious and most painful fact is I don't have a uterus. I don't have ovaries, but I do have a wife and I have two daughters, and I have been treating in women's health for over 20 years. So I do have a little bit of experience as far as like what can go wrong. And in the course of my treatment, what I've seen a lot of is infertility, right? And I will tell you right off the bat is I don't like to use that term. Infertility is a negative term. And what I like to use and what I like to talk about is fertility, right? Because in this industry and in the field of, it's called infertility, right? In this field of infertility, you're being told as a woman that you're getting too old, that your eggs are bad, that you're running out of time, you're getting pressure on the outside, and you're being, asked by your family members and your friends, are you pregnant yet? Are you pregnant yet? Right? And when you don't have the answer of yes, it's internally, it's devastating, right? And on top of it all, you're seeing all the people around you, like at the baby showers, they're getting pregnant, and it's like you internalize it in the sense of like, what's wrong with me? Well, there's nothing wrong with you. There's a lot of things wrong with society. The example I like to use is our species as a Homo sapiens hasn't evolved much over 20,000 years, and we basically live the same life as our ancestors did. So if you're being chased by a saber-toothed tiger, if your husband was trampled by a mastodon, if the neighboring tribe invades your living quarters, your mind and your brain are going to send messages to your reproductive organs that now is not the time to get pregnant. So if you were going to kind of correlate that with the example that I gave you before, right? Like, when are you going to get pregnant? When am I going to get pregnant? Your eggs are bad. You're running out of time. All these things, that stress really causes trouble, okay? And that trouble is the release of cortisol, which then triggers noradrenaline and epinephrine, and that's what we call sympathetic, right? That's fight or flight. That's why you're being chased by a saber-toothed tiger. That's why your husband was trampled by a mastodon. Your body's getting signals that it's not time to get pregnant right now. So the process itself beats you up. You beat yourself up, right? And then on top of it all is the lack of intimacy. Okay, and I think this is probably one of the biggest things that needs to be addressed in fertility is that, both partners need to nurture the relationship, right? And it's a very simple reason for that, and that is in order for the uterus to receive cues for pregnancy, conception, receptivity of the endometrial lining, and even transfer for IVF, that has to start up here. And that has to start between the couple, right? The wife and the husband, or if you're a same-sex couple, the two spouses need to be intimate and active, and the signals in the brain have to be sort of like aware that there are certain steps that need to be taken in order for there to be a successful pregnancy. Okay, and the system itself, the process itself, actually interferes with that. So, the way we've gotten to Western medicine is that we treat the symptom, which is no baby, and we have all the chemistry sets and labs to cram a baby in you. But even if you go through the chances in the hoops for IVF, you're still not going to get pregnant if the brain isn't ready, or if the brain isn't communicating with the reproductive organs. Okay, so that's why I emphasize intimacy. So whether you see me or you see a fertility specialist, IVF procedures, you still need to be intimate. And even as a point of fact, the CDC states that IVF is only 40% successful for women under 35, and those chances go up every time with another procedure. So if you're paying out of pocket, you're looking anywhere from $10,000 to $20,000. I don't know anybody who paid $10,000 for fertility treatments. It's closer to 20. So what are you saying? It's like every time you have to spend 20,000, and it's a better success rate. So it's a thing. Everybody's entitled to make their own judgments and opinions and do whatever is best for them. But I'm just asking you to kind of stop, listen to what we're saying here, get your body ready for it. Even if you do you're thinking about IVF, get your body ready for the IVF, right? Let's normalize those symptoms, those signals, right? Let's stop being chased by the saber-toothed tiger and give ourselves a break with acupuncture. Because acupuncture, as you know, we stated it hundreds of times on this channel, is that acupuncture releases endorphins. And we know that endorphins actually kind of cut down on the cortisol, which trigger the noradrenaline, epinephrine, and put you into sympathetic, right? So in that time when you're getting treated, you are giving yourself the time and the space for your body to go back to normal. But the linchpin is the intimacy, right? That's going to be, whether you see us or you see the fertility specialist, you still need to be actively doing it. Don't let the process and the procedure take the power away from your relationship. That's the punchline. So, this is just an introductory talk. We're going to get deeper into things about acupuncture as far as all aspects of women's health. So, because I've been doing it for such a long time and we've been focusing on infertility, infertility eventually leads to pregnancy. So there is an aspect of obstetrics. Did you know that acupuncture is really good for nausea? Did you know that it can induce labor? Did you know that it can, reverse a breech baby? Like if the baby's upside down, we can actually, flip it right side up and ready for pregnancy. These are things that kind of come up with treating women's health over 20 years. The other thing that we can look into and that I saw is that when, again, getting into this concept of Western medicine and being like a Cartesian sort of philosophy where we break things down to the simplest aspect. So we break things down to the symptom. We're only chasing the symptom. We kind of lose sight of the bigger picture. And when we lose sight of the bigger picture, we lose sight of the fact that a lot of times our patients who are going through infertility have hot flashes, have night sweats, have anxiety, have insomnia, have, emotional upheaval, mostly depression because progesterone tends to kind of like augment that emotion. You're looking at like a perimenopausal complex, and you may be 30, you may be 20, you may be 45. It really doesn't matter. That's not the profile you want to be in order to get pregnant, but yet they will fill you full of drugs. They will definitely hey, what's up, Red Seal Gaming? Thanks for joining. That's a lovely podcast if anybody wants to check it out. If you're into gaming and role playing, that's one thing you want to be checking out. But getting back on track here, when you look at the profile of so it's that sort of like perimenopausal profile will be categorized as low ovarian reserve. And what low ovarian reserve means is that your hormones are a little bit off, right? And you're presenting as somebody who's in menopause, which then cuts down on ovulation, throws off your period, irregular cycles and stuff like that. But because, Western medicine is really so Cartesian and we're only looking at the symptom, right? They're not thinking about why this is happening. They're just thinking about cramming a baby inside of you, right? So they're going to fill you full of meds. They're going to fill you full of drugs. They're going to even give you more progesterone, which is going to further throw you into closer to menopause to simulate that your body's pregnant so that the embryo can transfer and attach to the uterine wall. But we're not looking at the root of the problem. And this is what differentiates what I do and what Chinese medicine, specifically acupuncture and herbs, is different than Western medicine. Okay, like I said, you want to try hard enough with Western medicine, we'll cram a baby in you. I don't think that's a good strategy, right? But with traditional Chinese medicine and acupuncture, what we're doing is we are balancing all these symptoms, right? We're killing as many birds with one stone as possible. So if you have hot flashes, night sweats, anxiety, palpitations, insomnia, and weird irregular periods, then we have to look at the hypothalamic pituitary ovarian axis. Okay, I know it's a mouthful, but it is important. It is critical to understand that this is what regulates all aspects of women's health, right? So if I say I'm treating infertility, low ovarian reserve, or unexplained infertility, it's a problem with the hypothalamic pituitary ovarian axis. If a woman's coming to see me because she has hot flashes, she's going through menopause, it's a problem with the hypothalamic pituitary ovarian axis. If a young girl is starting her period and she has emotional upheaval and depression because progesterone and estrogen is trying to figure out what to do, right? It's not like your body woke up one day and knows how to have a period. It's got to work itself out, and that comes with repercussions. So if you're getting stuck in more of like a progesterone, like around the time or PMS state, you will have this emotional upheaval because progesterone has a certain effect on the brain chemistry that makes people uncomfortable or sad or depressed. So the answer isn't putting the girl on the pill and antidepressants. The answer is regulating the hypothalamic pituitary ovarian axis. And I'm sorry if it's a mouthful, but the punchline is that is what regulates how the brain communicates with the pituitary gland and then the reproductive organs. And it's very easy to kind of go astray. As if we circle back to the beginning of our presentation and we talked about you're too old, your eggs are no good, you're running out of time, when are you going to get pregnant? That so-and-so is pregnant at the baby shower, and the lack of intimacy, well, that's going to throw it in for a loop, okay? And the good news is that acupuncture and herbs is very good at regulating that and getting it back to normal. And that's what's going to be sort of the course of our presentation. That's what we're going to talk about on the webinar. So thank you for listening. If you have any questions at this point, please tell your friends, share this video, because we're trying to get some feedback here. Again, as you know, I don't like to talk at people. I like feedback. Let me know what you want to hear about. If you have any specific questions about women's health, I'd be more than glad to address all those things. It's not about just getting pregnant. It's not about infertility. Yes, it's part of it. It's a big part of it. And I want to be able to help people with that because it is rewarding. But it is about, young women, going through menarche. Yes, it's about older women going through menopause. Yes, it's about survivors of breast cancer who can't take, bioidentical herbs because of, issues with breast cancers and stuff like that. And it's also about being pregnant. It's about having double sciatica while you're 9 months. It's about, headaches and migraines too. That's another thing that people don't realize. A lot of times women who suffer from migraines, it's usually, they're usually menstrual headaches and there's some sort of like hormonal imbalance. And the punchline to this whole protocol and presentation and webinar is about how we can address it with the tools that we have. So again, if you have any questions, please feel free to reach out, especially if you have any feedback. Please let me know if there's anything specific topics that you want to know about women's health for the webinar. I'll be more than glad to address it. And don't forget to just like it. Don't go to don't just give a thumbs up. Right on the other side of that is a little share. Please share it. The more people know about this, the better off we are. And thanks for listening.